On June 3rd and 4th, USAID and UNICEF brought together more than 200 global health experts, from community health workers to policymakers to donors, to analyze evidence that shows social behavior change works in child survival programming. The systematic evidence review process resulted from an effort that began 1 year earlier with the Call to Action, A Promise Renewed. The goal was simple: use existing evidence to end preventable child deaths.
Call to Action for Child Survival challenged the world to end preventable child deaths in a generation. The call launched a new global movement committing to child survival, A Promise Renewed, to which we are all very proud to contribute through our diverse paths of work, including our deliberations here today.
Participants from Bangladesh to Baltimore brought different perspectives. They were charged with reviewing evidence that focused on 6 basic questions about effective interventions: supporting children and caregivers, empowering communities, sustaining health systems and policy supports, gender dynamics, stigma and discrimination, and advances in science, technology, and innovation.
This is a very interactive process. This is not a place to sit back and relax. It's going to be so much more helpful to us, and I think rewarding to you if you roll up your sleeves and dig in and give us the feedback that we desperately want at this stage.
The experts reported on the results of their hard work, tackling the questions with rigor and enthusiasm as they poured through 1,000 peer-reviewed journal articles, research reports, and evaluations.
In cooperation with UNICEF and many of you, world leaders in attendance embraced the strategic shifts necessary to speed up progress in reducing preventable child deaths around the world.
A lot of additional research is needed.
For 2 days, participants reviewed, reflected upon, and responded to the evidence review team findings.
So what is the evidence?
After the evidence was reviewed, roundtable discussions focused on the future of policy, programming, and research. Evidence to action was the theme of the day.
So the evidence that you have uncovered that document these and other lessons increases the chances of our collective success. The conclusion of this 2-day evidence summit marks the beginning of a new chapter, the development of an evidence-to-action strategy.
Looking forward, the evidence will be applied to social and behavior change programs that help children survive preventable illness.
Ultimately, the goal of today's conference and the goal of your collective efforts are to make sure we translate our knowledge into real results at scale. Because all of the biggest successes that have happened, frankly, in development, in health, in agriculture, in water and sanitation, have depended on very large-scale change in behavior that have been self-reinforcing and sustainable long after the intervention has gone away.
The summit concluded with a visitor from Sesame Street.
Look, I may live in a trash can, but I do know how important it is to keep kids healthy.
Fantastic, because all of us together here are doing important things for children around the world, as we do also for our children here at home.
The summit participants were treated to an inspiring media festival before departing to continue their efforts to save children's lives.
What are you teaching your children?